BiPAP, or bi-level positive airway pressure, is a device that is used to help patients breathe better. It can be used at home or in the hospital for critical situations. But before we look closer at what BiPAP is, let's go over some basics of breathing. Our lungs can be seen as a sort of machine helping to pass objects from one area to another. Inside our lungs is many balloon-like sacs that act as a space for oxygen to enter and carbon dioxide to be released. Think of oxygen as food for your cells and carbon dioxide as trash. So how do we get oxygen in and carbon dioxide out? Well, oxygen is all around us in the air. Our lungs have a muscle called the diaphragm that contracts, and when it does, it causes our lungs and those balloons to expand, so air fills the new space. When these muscles relax, the balloons deflate, and so air is pushed back out. So now that we know some basics, let's look at how BiPAP can help. In some cases, with some diseases, our lungs can be deformed or compromised to a point where the space needed to receive oxygen and release carbon dioxide is reduced. This means less food for the cells and a buildup of trash. Let's take, for example, a person with severe pneumonia. When the lungs fill up with secretions, they normally make their way up through the throat so that you can cough it out. But sometimes it builds up in those balloons, taking precious lung real estate. In order to combat these issues, our bodies need to breathe more, and that can become a lot of work, especially if these issues have been going on for a while, like running a constant marathon with no breaks. Over time, our breathing becomes weaker, and that's when BiPAP can come in to assist. Instead of you pulling air into your lungs, the machine pushes in order to take some of the pressure off of yourself. In the case of CPAP, or continuous positive airway pressure, this constant pushing is just that, constant. But with BiPAP, there are two different pressures. One pressure when you take a breath in, and a lower pressure when you breathe out. This allows us to give more air without the constant feeling of pressure that may feel suffocating, which is a bad feeling to have when you're already having trouble breathing. BiPAP is also used at home in cases such as sleep apnea. When you fall asleep, a lot of muscles relax and can close your airways, so a pressure is applied in order to push past such obstacles. Face masks are mainly used to deliver BiPAP, but in some cases, nasal masks or nasal pillows can be used for more comfort. I hope this gives you a better understanding of how BiPAP works.